It's time now for the award-winning #1 local talk show in Northeast Pennsylvania, The Sam Lesante Show. Now here's your host, Sam Lesante.
Well, folks, today I'm going to give you an update on healthcare in the greater Hazleton surrounding area. Very happy to have on the show the main man himself, very good friend of mine, John Fletcher, and also no stranger to the area, Dr. Valente, who is the chief medical director. Of course, John is the big man. He is the president of LVH-H. And nice to have you on the phone.
Thank you. Nice
Same
to be
you,
here.
Tony.
Thanks,
First of all, let me tell you, John, I know you a long time. I always liked you. I like you even better now because what you're doing in the healthcare in this area is just through the roof. You know, we have so much to be proud of in this area, and we are so far ahead in this area in healthcare. And I learn a lot every time, Tammy brings the doctors on or people who are affiliated with. It's just amazing. Now, I know you very well, okay, but we have a lot of new viewers in, Mono City, Shenandoah, Tamaka, Mountaintop, etc., that may not know John Fletcher. Tell us a little bit about yourself.
Well, let me first state that it's not what I do. We have a great organization, and what we've been able to accomplish has been truly a team. So give credit to all of the physicians and the staff. It's just been a remarkable experience for me in Hazleton. So I'll tell you a little bit about myself. Born and raised in northeastern Pennsylvania. I was actually born in Bloomsburg, raised in Berwick, graduated from Berwick High School, stayed local all of my life. This is home. Joined Hazleton, it's coming up on 12 years. I've been here for 12 years. Started out in business development with Hazleton, moved into the chief operating role. Through that turnaround, the transition of where we were to where we are today. And then in February of 2014, I was asked to step up to the president's role. And so it's been a remarkable, incredible journey. Truly loved every day. I love my job.
When this merger happened, okay, there were a lot of people concerned, in the areas, okay?
Sure.
We're going to lose our identity. We're going to lose this. It was always we're losing instead of what we were gaining. So, to give us an example, what happened, okay, since the merger? There's a zillion things that happened,
Yes,
but some important changes that you saw with the merger.
Yeah, so we really focused on growth. I think the last time I was here, we talked about the outmigration, people leaving Hazleton for healthcare services. I know that gets under your skin, that the people sometimes don't realize the quality that we provide.
Exactly.
And so we really wanted to focus on how we stop the outmigration and expand our services. And so we did things such as the cancer service line and the orthopedic service line. We opened an express care on Broad Street. We expanded into Hometown. We recruited nearly 20 new physicians and advanced practitioners, nurse practitioners or PA, since the merger. And so truly opened an office in the Valley, the Cunningham Valley. We focused on growth, and we have been very, very successful in both expanding our geographic area, but as well as stemming some of the outmigration, and people are now staying local for healthcare, something we always wanted to do.
Oh, yes, and I've been saying that since 1994. We have great physicians, all in the medical area that we have, and we've been blessed with that. But when you expand, like any business, when you expand, you have to look at affordability. You have to look at, do I grow too fast? And what areas do I expand in first? Okay, so how do you do you do this with your staff, the board of directors, or how do you determine? Do I go to orthopedics? Do I go to oncology or whatever?
So what we look at. So the answer to your question: do we do it with our staff? Do we do it with our board? Yes and yes. But we also have this fabulous network. We're part of this very large network that brings additional resources to us in the business development side. And so our growth areas are strategically selected, areas of need. So if we have a service line where we're seeing significant outmigration, we focus on it. Orthopedics was one of them. That we really thought what we needed to do is to recruit orthopedic surgeons that are committed and are local. And when we look at expansion, express care, If you recall, and again, I believe we discussed this previously, we had a problem with the emergency department. In that, people were using the emergency room for non-emergent care. And our solution to that is let's open an express care, an urgent care center, to try to pull those non-emergent patients to a different setting. And so when we opened the express care, it has been a tremendous success. We have exceeded our expectations. We were expecting a little slower growth, but from day one, I believe the community has really embraced
No question.
the express care location. And so it's done through very thoughtful process of understanding our market and determining the strategic direction we want to go in.
So let's clear up something here, okay? Because you're talking about the emergency care, okay? And, you know, sometimes someone will go to the emergency room and they're waiting, all right? Now, I know you've addressed the wait time, et cetera, but how does that, so people understand, they didn't forget about you, okay?
Right.
I know this is redundant, but just so they know how the emergency room works.
So we still have work to do. I don't want you to think that we have solved our wait times in the emergency department. Actually, what we've seen is since we've opened the urgent care center, that has grown, but our emergency room volume is still strong.
Wow.
And so it really shows the need for that urgent care side. What we do, and I'll let Tony talk a little bit more about this, is it's based on the severity of the person walking in. If you're having a heart attack or a stroke, you go right back. But we do the assessment, triage. And determine the level of care needed. And so that requires, if you're at a lower level, good, right?
Yes.
You really don't want to be in that higher level.
Yeah.
But it does mean that you could possibly have a wait time based on the volume in the back.
But you've come a long way. So, I mean, a tremendously long way from when you first started, okay, as far as wait time. Going back to the merger, this is a two-way street here, okay,
Right.
with Lehigh and okay. I'm sure in this merger there had to be stuff that we're able to help them with and they're able to help us with. Am I correct in saying that?
Yes.
Okay.
Yeah. And so I think, you know, it is the network, our network, such a large organization. I think what they've allowed us, and we do this together, is understanding how a small acute care facility truly works. And so I've said from day one, what we do with the network is, it's not what the network does to us, it's what we do together.
Yes.
And so we talk about the strategic planning, and we talk about those areas that should be more network driven versus what will remain local. And everything that we have today is still there. But there's some things like government relations, that network legal compliance. There are some functions that are centered at the network, and they cover all of their facilities. And so it has been a learning experience for both sides. I think we've learned a lot about the complexity of the network and what they make available to us and tapping into that resource. They just have brilliant physicians and leadership, and so tapping into those resources has been just incredible. And I think we've taught them the small acute care facility and how that is different than a Cedar Crest.
As a president of the organization, okay, there has to be a lot of accountability in all areas. You know. So what do you do? I mean, as the president of Lehigh Valley Hazleton, what do you do during the day? And don't say you sit there and relax and watch television.
So we spend a lot of time on strategic planning and handling the day-to-day operations. And so in a facility such as ours, we don't specialize in any one specific area, and I think again Tony can discuss that. And so, you know, any given day we'll be working on our growth strategy. Any given day we'll be working on our patient satisfaction. We're dealing and working with our physician colleagues. We are up on the floors talking to the staff and understanding where we're doing some great work and where we have to improve. And so the most exciting part of my job is I can have a schedule that just goes out the window at any given time.
Yes, tell me
it's
all about
one
it.
phone call
Yeah,
and
changes.
it changes.
Well, one thing about you, John, is that you are very hands-on. You know, and you could see the result in the hospital, you know, because if I'm talking to some people up there visiting, they'll, you know, say, this Mr. Fletcher, yeah, we just saw him the other day. He was on the floor, you know, which is interesting. It's good to see that you have, you know, this merger and the fact that what we've done for healthcare in this area. And when you bring the doctors that you're bringing in, or all the PAs, et cetera, and the experience that they have, okay, and I'll ask you, Dr. Valente, you're the chief medical director, correct? Now, we know who you are in this area very well, but as I said to John, there are many people that, you know, we have a lot of new viewers around the area. Tell us a little bit about you, Dr. Anthony Valente.
Okay.
The good stuff.
Only the good stuff, Sam. Only the good stuff. Well, I was born and raised in Hazleton, so I'm homegrown. I went away to college. I actually spent some time as a school teacher, taught in the Harrisburg area for 5 years before going to med school. Went to med school at Hershey. Got my internal medicine residency done through Temple in Scranton, and came back to town after that. Practiced solo as an internist for, I guess, about 17 years or so. Wow. I don't really remember exactly. And then came on board at the hospital in 2004, I guess, as the Vice President of Medical Affairs, which is my official title, you know, right now. So I've been there in that role for the last 11 years.
You like it?
Absolutely. Yeah, I wouldn't do it.
It's a different role from, you know, practice.
It's a different role. I still practice. I still do critical care medicine, so I still keep my hands in the clinical side of medicine, but I do enjoy my administrative duties as well.
We're going to take a break, folks. I'm talking to John Fletcher, who is the president of Lehigh Valley Hospital here in Hazleton, and of course Dr. Valente, who is the chief medical director. Now, I want to give you a website because there's so many providers, there's so much that's going on. I think the best thing for you to do is learn, okay, before you decide to leave the area, okay? And you know, I'm very happy to say that many of you are staying in the area, you know, because we have shows like this to inform you. But lvhn.org/Hazleton is where you want to go to really check the providers out, and also 570-501-4000, or if you want to make an appointment, it's 570-501-4LVH. We'll be back right after this. Welcome back to the Sam Lesante Show, folks. Remember, 24/7, you can watch all of our program on ssptv.com. My email is sam@ssptv.com. And if you want to know about all the health shows we have, they're there, but also go to lvhn.org/Hazleton. Now, Dr. Valente, let's talk about, you know, there are a lot of great things happening, and we could spend 4 hours discussing everything that's happening. What are some of the major initiatives, tell me about the quality initiatives and the metrics that are in place right now at Lehigh Valley Hazleton.
And Sam, I brought a cheat sheet with me for simplicity's sake. But I think if you remember on previous shows way back when we were on, and we had mentioned that we when we had the turnover at what was then Hazleton General, we focused on certain areas that we felt were the major areas that we had to focus on, because those were the diagnoses that brought people actually into the hospital. And so what I'm just going to give you an update on some of the stuff that we've done in those areas. For example, with heart failure, we're now at 7 years in a row where we're either a Gold Plus, or the last 3 years a target hospital for heart failure, which is a level above Gold Plus. And that simply means that you're meeting certain metrics by the American Heart Association. We also have received our Stroke Gold Plus award for 7 years, and the last 4 years been a target hospital. And I'm pleased to say this last year we've been classified as a stroke elite hospital. And what that means, Sam, that means that our stroke patients that come to our emergency room are treated with a medication to block or to unblock the artery within 60 minutes of arrival, which is really difficult to do, if you can imagine. Yes. Getting the whole workup done and getting the patient treated, and within an hour of arrival. Also, we're listed in the U.S. News and World Report for heart failure and stroke, if you've seen that out the last couple of years. Yes. We've been recognized by the Hospital Association of PA for performance in pressure ulcers and venous thromboembolism. We've received Gold Performance Achievement Awards for our care of acute myocardial infarction and coronary artery disease from the National Cardiovascular Data Registry. We're a primary stroke center, as I mentioned before, through HFAP. We've been recognized by Quality Insights of Pennsylvania for our work with catheter-associated urinary tract infections. I mean, I could go on and on, but I think we've really hit the areas that we wanted to hit pretty hard, over the last 7 to 10 years, and those are things like AMI, stroke, heart failure, sepsis, pulmonary disease, which were the 5 focus areas that we had 10 years ago.
When we opened the show, Tony, we talked about John and John Fletcher and how great he's doing, but he said, Sam, it's the team, okay? And that's so important. When you're looking at all of these awards you're getting, there has to be total teamwork involved here.
Absolutely, absolutely, and it's both. It's administration, it's our other directors, it's our folks right at the front door. It's the nurses on the floor. It's the techs. It's the medical staff. It really is a team effort. I mean, everybody's got to play ball because you're only as strong as your weakest link, and that goes for all of this. And for this to really work, for example, for that door to needle time to work like that, you've got to get right down to the guy that's coming to draw your blood. He's got to be there on time. The blood's got to be drawn on time. The CAT scan tech has to get the CAT scan done. It's got to get read by the radiologist. This all has to be happening concurrently. And if you have one person that drops the ball, you drop the ball. Like I said, you're only as good as your weakest link.
And
so
boy,
it's truly.
I can imagine the many lives that have been saved, okay, or improved, have better quality of life because we have this health care in the area. I just recently had the people on from Medevac, and I learned a tremendous information about what they're doing in that helicopter, okay? So when someone gets a bill, they have no idea what
goes into it.
What goes into that, okay?
And Sam, when you asked John, what benefits have the network, has our affiliation with the network been, and that's one of them, is now as good as the helicopter has always been, it's even better now because it's parked outside the hospital. Yeah. So we've taken that to the next level. We always did have those services, but now the helicopter is right outside the ED door, and the crew is on campus. So we've knocked minutes off there as well.
I think the other incredible thing is in working with the network, the coordination that not only occurs under the roof of the hospital, but also the connection to the network.
To Cedar Crest, yeah.
To Cedar Crest, and for the neurologist and the neuroradiologist to get involved in the care.
Teleradiology services, teleneurology services, and all these patients are followed up. We find out what's happening to these people. We know what's happening to the people we send down there in real time. Yeah. So we follow every case up, and then we look at it and we take it apart and we see if there's anywhere where we can improve on the next one.
You've been with the hospital a long time, so you've seen tremendous growth, etc. When we're looking at the amount of doctors and the teamwork, okay, the fascinating, because of this structure of the network, if I'm at Dr. Benio's, who's my doctor, and he wants to check maybe if I went for a MRI or whatever, that he knows exactly what's happening because of every doctor knows exactly what's happening.
All connected.
Yeah.
Correct.
So you don't have to worry about by the time I get this result, etc. They're right there. Okay,
right
more
there.
your blood work, and it's like that, which is amazing, John.
It's absolutely amazing, and significant investment in both the capital dollars required to get up and running, as well as with our physicians. There's a learning curve that goes with that, and so the investment that the physicians made into understanding how the system works, and to have that medical record when you walk into his office and he has the results not only for the prior 2 months, but prior years.
He's checking everything
right,
out.
Right there.
How was the blood work? When we're looking at this recruitment, okay, a lot goes into that. You just don't pick, well, we'll hire Dr. Lesante. How do you go, like, remember I said, there's a lot involved here. Do you work together in recruitment as to the different areas? You bring experts. If you're hiring an orthopedic surgeon, do you bring experts in to know about that orthopedic surgeon or whatever? How does that work?
Well, so there is a lengthy due diligence process. And so how do we first identify the need? What we look at is we take a look at the demographics of our service area. We determined where we are currently with the number of physicians that we have in that specialty. We also look at the age of the existing medical staff. Is someone close to retirement? And then we develop what we call a medical staff development plan that really selects those areas that we want to recruit. And so that's where you see orthopedics, the oncology, podiatry, general surgery, physiatry, family practice, and so many areas. So that's the beginning. So what that does is it identifies that we need an orthopedic surgeon in our market. And then it's a very competitive environment. And so a physician may have 20, 30, 40 different opportunities available to him or her. Mm-hmm. And so you are competing with so many other healthcare institutions for the talent of that physician or physician's assistant or nurse practitioner. And so it's very complex. Also, you're dealing recruitment in the Northeast PA. Is a little bit more difficult because people want to live in the city. They want to be in Philadelphia or New York. Our proximity to both New York City and Philadelphia is a huge advantage. Since joining the network, it also states that we have the ability to now not be a 50-person group, but we are now a 750 with Lehigh Valley Physician Group in Allentown. And although we are still have our own identity, we are part of a larger network. And then it just takes a whole lot of hard work. Melanie is our chief recruiter, and she does an excellent job in both selling the community, because she was born and raised here, as well as the region, as well as our facility. We involve Dr. Valente. We involve the physicians in the interview process. We also involve the chairs down at the network, because we want the network to also meet our candidates. And so it's a well thought out process for recruitment.
Well, if you want to know the success that you're having, okay, when I interview the individual doctors that came here, especially if they're new ones, and I'll say, well, okay, why did you come to the area, okay? And it's always about the healthcare that they have, and they love the area. The surrounding area, they love the community, which means it's a tribute to our area that we bring them in here.
And you know what else? They love our vision.
Yes.
And so I would tell you, as we're sitting down with the physicians, we can show them what we have today.
Oh my gosh.
But we can also talk about when we were working with Dr. Evans in oncology, what did we have to show him? Really nothing. We have a vision of what we want to do in the cancer
Let's
service
stay with
line.
him, for example, Evans. Now let's talk about this new cancer center. I got about a couple of minutes before we go to break.
Okay.
The new cancer center.
Yep. So we recruited Dr. Evans and Dr. Hotchner, as well as we have a physician's assistant that we're working with. Our goal is to provide comprehensive cancer services. Prior to this, from Lehigh Valley Hospital, Hazleton, we did not have any physicians who were part of LVPG in the cancer service line. And so we recruited, and what we've asked both Dr. Hotchner and Dr. Evans is help us build a program. I know we're starting from ground zero, but we want to start building a program. Brought Dr. Evans on first, worked very, very closely with the network. They have a fabulous program. And so there's the other benefit of the network.
Yes.
There are resources that when we're building a service line that we just don't have locally. But to have that team, both from an administrative standpoint, but as well as a physician leadership standpoint, to help us build that center and that service line, it's just incredible. It's been really a positive experience. And so right now, we have the practice located at the Desson Center, right next to the Health and Wellness Center. And we're going to be moving into a new location, still on the Beltway, right across from Hazleton Eye Care. In that general location. It's going to be about a 7,000 square foot building. We will be relocating the physicians there. And it's going to offer more comprehensive cancer services. And I don't know, Tony, if you want to add anything.
No, I think you hit the nail on the head, John. Really, the two oncologists that we got are really superb.
I interviewed them.
Very,
great.
very strong clinicians, well-trained, good backgrounds.
Terrific.
And they've already really hit the ground running, both of them. So this is more or less just a location change and then an expansion of services. But both of them are really integrated into the medical staff
they
already.
love it. Folks, I'm talking to John Fletcher, who is the president of LVH, Lehigh Valley Hospital, Hazleton, and Tony Valente, Dr. Valente, who is the chief medical officer. We'll be back right after this. Welcome back to the Sam Lesante Show, folks. Today I told you about healthcare. It just gets better and better. My guest today, John Fletcher, who's the president, and Dr. Valente, who is the chief medical officer. Remember, lvhn.org/Hazleton. All of that information is there. Okay, I mean, every time I do a show, it just gets better and better and better, okay? Tell me about the future.
Okay. Yeah, and it's going to get better and better and better. We continue to recruit. I think we have about 5 or 7 new physicians or advanced practitioners signed that's going to be joining us in the next couple of months. General surgery, podiatry is coming on board. We have some family practitioners that we're working with. Dr. Stish has decided to join Lehigh Valley Physician Group, and Dr. Jill Snyder has also decided, so she's going to be joining LVPG. We're going to focus on the orthopedic service line and continue that growth. We have seen significant growth since we added the orthopods. But what we realized is how we're marketing it, and I think we need to get to the community to say it's not just about orthopedic surgery. That what we truly need to do is approach this from both physical medicine and physiatry, to the therapy services, to chiropractors, to neurology, to occupational medicine, and orthopedics involved as well. So we're approaching this from the standpoint of it's not just about orthopedic surgery. That if you as a patient are having some knee pain, don't wait. Because if you can come in and we can get you on a PT program that could help it out and work with our physiatrist to help it out. And so more to come on that. So what we're trying to do is instead of functioning in silos where rehab and orthopedics and physiatry and all these different physicians, they begin to work together and take care of the patient through the continuum of care. And so you're going to see more about the orthopedic service line and how we're developing that. You're also going to see additional expansion. I told you that we moved to the office to the Valley, and we added pediatrics and primary care. But we're also going to be expanding into the Mountaintop area, and we're going to have a pretty good footprint of primary care and some ancillary services that we want to provide there. Also, we have the MRI that for the first time in the history of Hazleton General Hospital and now Lehigh Valley Hospital, Hazleton, we have moved an MRI to on-site of the hospital. And so traditionally, what we've done is we've had to move patients that needed an MRI to the Health and Wellness Center. Not a convenience for the patient. And so they'd have to get into an ambulance and be transferred over to the Wellness Center and back. We're going to be starting in mid-September, late September, early October on having that service right here at the hospital.
Tony, anything do you contribute to the future? He could go on. I could talk for 4 hours with John.
I think the main point is the future is really bright because of our relationship with the network. And again, this could be a whole nother show of all of our connectivity that we have with them and where we're going with medical conferencing, which we'll bring to our hospital via telemedicine and link-ups that we have there with all different disciplines and clinicians that we can now bring in for conferencing, for continuing medical education. As John mentioned, different service lines that we really couldn't offer before. We have electrophysiologists coming up now, which
You're killing me.
saving people to saving the trips back and forth. So there's just so many different areas. But I think in a nutshell, I think what we're trying to say, I think, is that the future is bright because of our relationship with the network and the resources that they bring to the table for us as well.
Well, it's such a pleasure to hear all the good news, and it's such a pleasure to see how everyone's working as a team. And I always tell the viewers, no matter whoever's involved in healthcare, give them a break because they really work hard. Your aides, your nurses, the receptionists, They're really under a lot of stress every day, and they handle it very well, John. You know, they really do. And I have to compliment everybody because it's a great system, folks. It's so simple. You know, I have said this for years. Before you think about going out of town, and most of you are beginning to get onto this, go to their website, call them. You will see doctors that are absolutely superb. Okay, I did work in Philadelphia at some hospitals, and I want to tell you, I don't want to mention the hospitals that we worked at. They couldn't come close to what we have in the greater Hazleton area, and I mean that sincerely. We'll see you next time.